Finally, let me discuss an issue that is a great concern to me, to members of this chamber, and to the public. And that's how we pay for this plan. Now, here's what you need to know. First, I will not sign a plan that adds one dime to our deficits, either now or in the future. I will not sign it if it adds one dime to the deficit now or in the future, period. And to prove that I'm serious, there will be a provision in this plan that requires us to come forward with more spending cuts if the savings we promised don't materialize. Now, part of the reason I faced a $1 trillion deficit when I walked in the door of the White House is because too many initiatives over the last decade were not paid for, from the Iraq War to tax breaks for the wealthy. I will not make that same mistake with health care. Second, we've estimated that most of this plan can be paid for by finding savings within the existing health care system, a system that is currently full of waste and abuse. Right now, too much of the hard-earned savings and tax dollars we spend on health care don't make us any healthier. That's not my judgment. It's the judgment of medical professionals across this country. And this is also true when it comes to Medicare and Medicaid. Now, finally, many in this chamber, particularly on the Republican side of the aisle, have long insisted that reforming our medical malpractice laws can help bring down the costs of health care. Now, there you go. There you go. Now, I don't believe malpractice reform is a silver bullet, but I've talked to enough doctors to know that defensive medicine may be contributing to unnecessary costs. So I'm proposing that we move forward on a range of ideas about how to put patient safety first and let doctors focus on practicing medicine. I know that the Bush administration considered authorizing demonstration projects in individual states to test these ideas. I think it's a good idea, and I'm directing my Secretary of Health and Human Services to move forward on this initiative today.